Thank you for joining me today. In this video, we are going to learn more about clozapine. Clozapine is an antipsychotic medication and it causes granulosis. So clozapine is a typical antipsychotic medication primarily used treatment-resistant schizophrenia and for reduction of a risk of suicidal ideation behavior in people with schizophrenia. Clozapine is also treat schizoaffective disorder, and it is widely regarded as the most effective antipsychotic medication for patients who have not responded to other psychiatric medications. What makes clozapine different? Unlike most antipsychotic medications, clozapine often remains effective when at least two or other psychiatric medications are failed. It also tended to cause few extrapyramidal symptoms. Movement-related side effects affect as rigid or tremor. So ABS symptoms is rigid muscle rigidity and tremors. Then many of the other medications. So clozapine has a few side effects of muscle rigidity, tremors compared to other psychiatric medication. It is a typical antipsychotic medication. It treats schizophrenia that is not responding to other antipsychotic medications. And because it is a unique effectiveness, may clinical guidelines consider it the preferable option for treatment-resistant schizophrenia. Clozapine is approved for Clozapine is indicated for treatment-resistant schizophrenia, schizoaffective disorder with recurrent suicidal behavior. Clozapine, it is sometimes used off-label. Off-label means the FDA is not approved that in a selective situation under the special supervision, although approved indicate different countries. However, it has a safety consideration. The most risk associated with clozapine is severe neutropenia or granulocytosis. Granulocytosis is potential danger that reduces the white blood cell that increases the risk of a severe infection. Regular blood monitoring is therefore an essential part of the treatment. Other serious include it causes seizure, it causes cardiomyopathy, inflammation of the heart, cardiomyopathy, severe constipation, bowel complication, low blood pressure. The common side effects of clozapine include drowsiness, sedation, increased drooping, constipation, dizziness, weight gain, low blood pressure. So you want to monitor clozapine. A distinct feature of clozapine therapy is ongoing monitor of the white blood cell or absolute neutrophilic counting, depending on the neutropenia earlier, to detect neutropenia earlier. FDA is approved in the United States. FDA removed the clozapine in 2015, but blood count monitoring remains the recommendations because of the risk of severe neutropenia still exists. Clozapine clinical significance is that is the firstly widely recognized atypical antipsychotic and remain unique psychiatric because of it is benefit of treatment resistant schizophrenia and suicidal behavior. Despite the requirement to carefully monitor, it is often considered one of the most important medications available for severe psychosis. So, we want to talk about what we want to talk about more is clozapine include agranulocytosis and rapid hematological monitoring and emergency clinical management protocols. We want to learn more about pharmacology of the clozapine, and we want to explain why it remains the gold standard of treatment-resistant schizophrenia, explain pathology, epidemiology, risk factors associated with clozapine-induced neutropenia, agranulocytosis, recognize early clinical sign of agranulocytosis, and differentiate it from other causes of neutropenia and sepsis. So low neutropenia can lead to sepsis and death. We want to apply evidence-based hematology monitoring protocols before and during the clozapine treatment. Implement emergency stabilization and infection management for patients presenting with agranulocytosis. Interpret absolute neutrophilic count. result and determine appropriate clinical action. We wanted to learn more about developing a long-term monitoring, patient education, relapse prevention strategy. So as we mentioned, clozapine is the most effective antipsychotic for treatment-resistant schizophrenia and has demonstrated superior in reducing psychosis symptoms, reduce recurrent hospitalization, aggression, and suicidal behavior. Appropriately selective patient despite these benefits. Despite these benefits, clozapine carries a rare but potential life-threatening risks of agranulocytosis or low neutropenic. A prolonged reduction in circulating neutrophilics that marks an increased susceptibility to severe infection and fungus, severe bacteria and fungus infection. Although the accident of agranulocytosis has declined substantially because of the mandatory hematological monitoring, clinicians must rapidly recognize early warning signs and interpret lab abnormality, then discontinue the clozapine when indicated and initiate urgent medical evaluation and coordinate multiple discipline care. So failure to recognize agranulocytosis can lead to septic shock, can lead to pneumonia, can lead to necrotic tissue, soft tissue infection, can lead to meningitis, multiple organ failure, and death. Sepsis can lead all that. So, severe agranulocytosis happens approximately 0.3 to 0.8% of the patient receiving clozapine. Neurotropic is more common and often precedes to neurotropenia is more common and often precedes agranulocytosis. High-risk periods include a greatest risk occur when first 6 months of the treatment, partially within at least the first 18 weeks. Risk reduce substantial after 1 year, but never goes to zero. agranulocytosis, the persist mechanism remains incompletely understood. So ammonia mediated, what happened is ammonia mediated destruction. Direct bone marrow toxicity. It leads to bone marrow toxicity. It leads to bone marrow toxicity. Reactive metabolic may injure granulocytobrio cell. So it destroys that cell in the bone marrow. Genetic susceptibility include certain human leukocyte antigen, and vary may increase susceptibility. The risk factors include patients at the increasing risk are previously drug-induced neutropenia. So if the patient had a history of neutropenia, you don't want to prescribe this patient to that. Prior clonazepam associated neutropenia. So if the patient has that before or history of that, you don't want to prescribe this to that. Advanced age, if the patient is senior or older, they have that risk. Female, they have the risk of developing neutropenic clozapine. It can induce neutropenia or agranulocytosis. Also, people who have a low ammonia system, they can develop that. They have a risk factor concomitant of myelosuppression medication. If you are taking myelosuppression medications, it can lead to that. Clozapine has complex receptor activity involving dopamine D2 receptor, dopamine D4 receptor, serotonin receptor, alpha adrenergic blockage, histamine, clinical features of the agranulocytosis include, this is how you know the patient is developing agranulocytosis, is they will have a fever, they will have a sore throat, they will have a malaise, they will have fatigue, gel, mouth sore, gingivitis, inflammation of the lip and gum. These are the signs that the patient is having a low white blood count. These symptoms should always prompt immediate lab evaluation in any patient. So if you see patients who have these symptoms like sore throat, fever, malaise, fatigue, gel, mouth sore, gingivitis, they need to be evaluated immediately. progressive infection, neurotropenia worsens. Patient may develop pneumonia, cellulitis, UTI, perirectal infection, sepsis. Neutropenia. If the patient neutropenia get worse and low, it leads pneumonia, cellulitis, UTI, perirectal infection, sepsis. Absolute neutrophilic count of less than 1,500, that is what is called neutropenia. Modern neutropenia is defined as ANC of 500 to 1,000, agranulocytosis or severe neutropenia is less than 500. This level carries remarkably increased risk of life-threatening infections and require urgent intervention. Hematology monitoring. You want to monitor the hematology before initiating clonazepam. Obtain a baseline complete white blood cell with differential. You want to confirm that the ANC meets the currently prescribing requirement. There's a prescribing requirement, and neutropenia count has to meet that. You want to evaluate for prior hematology disorder and medication that may suppress bone marrow. During treatment, you want to do ongoing absolute neutropenia count. It's mandatory. You want to monitor frequently depending on the treatment and regulate. So every 6 months is treatment duration is every 6 months. You want it weekly, typical weekly, you want to monitor absolute neutropenia count. If the treatment is 12 or 1 year, every 2 weeks, you want to monitor the typical absolute neutropenia count. If it's more than a year, or patient is going to continuously take clonazepam, you want to monitor the absolute neutropenia count every 4 weeks. Absolute neutrophilic count is interpretation is 1,500 is normal and you can continue the treatment. If it's 1,000 or 400, 1,000 to 400 is mild, not neutropenia, and that increases the monitoring and evaluation clinically, because you can see it's coming lower. It was more than 1,500, and now it's 1,400. So that requires monitoring. If it's 500 to 1,000 is moderate neutropenia, and you want to interrupt the treatment. You want to stop the clozapine. You want to stop the clozapine medication and interrupt the treatment, and obtain a urgent evaluation. Consult with hematologist. If it's less than 500, it is agranulocytosis, and immediately discontinue clozapine, and you want to hospitalize the patient if clinically indicated, and you want to treat as a medical emergency. Patient with documented benign ethnic neutropenia may have different absolute neutrophilic count threshold. Assessment for emergency assessment include the airway, the breath, the ABC. You want to assess the airway, breath, and circulation. You want to assess the disability, exposure to infection, diagnostic evaluation. You want to recommend investigation of a complete white blood count with the differentiate, and repeat the absolute neutrophilic count. You want a urinalysis, urine culture, blood culture, test the imaging for pneumonia, comprehensive metabolic panel, lactate level, inflammation markers. You want to study all that. Emergency management has steps. So first step of the emergency management include stop the clozapine immediately, and second step is treat as a febrile neutropenia when appropriate, and the third step is to hospitalize. So what each step? First step, when you want to stop the clozapine, should be discontinued promptly in a patient with confirmed agranulocytosis or severe neutropenia according to current prescribing recommendations. So if the patient has a agranulocytosis, you want to stop the treatment. Step 2 is if the patient having a symptoms like severe fever, severe neutropenia, suspected of infection. That is the second step. The third step is to hospitalize if they have agranulocytosis, fever, sepsis, pneumonia. They need to be monitored and be hospitalized. Empiric antimicrobial. You want to initiate antimicrobial therapy should be guided by institution febrile neutropenia protocols, locate the resistant pattern and infection resource, allergy history, infection disease, consultation with the appropriate infection experts, hematology and growth factor therapy, intensive care management if the sepsis is increasing and respiratory failure or multiple disorgan or consistently low blood pressure or requires vasopressor or mechanical ventilation. You want to consult with psychiatrist, hematologist, family medicine. You want to educate the family and share the decision with the family. Alternative antipsychotic therapy if the clozapine must be discontinued. You want to reassess the diagnosis and treatment goal and initiate alternative evidence-based antipsychotic medication after the acute medical condition has established. You want to monitor closely for the symptoms recurrently and medication tolerant. You want to educate the patient and family about the infection, fever, sore throat, chill, mouth sore, so they can know what to expect. Okay, thank you for joining me today. Please subscribe and join me again. Thank you.